Congenital anomalies and hydrocephalus. Neural tube defects. Most common congenital malformation in CNS is 3.5 to 4 incidents per thousand live births. That's the most common congenital malformation in CNS. Neural tube defect. Risk in subsequent pregnancies is 2 times. Risk factors: folic acid deficiency in mother, maternal drugs using like anticonvulsants like valproate, carbamazepine, overt uncontrolled maternal diabetes, pathology, anterior neuropore, failure to close, neural tube defects, normal closure 24 days, posterior neuropore, failure to close a caudal neural tube defects, normal closure within 26 days, types, caudal neural tube defects, spina bifida occulta. That's a caudal neural tube defect. Asymptomatic condition. Clinical features may present with swelling, tuft of hair over the defect. So defect underlines intact skin, occult, underdeveloped posterior vertebral arch, intact spinal cord and meninges. Meningocele. Meninges, CSF filled cavity. Trans-illumination test is positive. Meningomyelocele. Myelospinal cord structures. Most severe caudal neural tube defects. Associated defects is Arnold-Chiari type 2 malformation. 80% have hydrocephalus. 80% of the time it is meningomyelocele. It is Arnold-Chiari type 2 malformation. There is an increased risk of rupture, infection, meningitis, spinal nerve root herniation, decreased tone and flaccidity in lower limbs, bowel and bladder incontinence. Cranial neural tube defects, anencephaly types, complete and partial. Complete anencephaly is called holoanencephaly, partial is called meroanencephaly, anencephaly absent skull, most severe neural tube defect not compatible with life. Encephalocele, defect in skull, herniation of brain or swelling, most common site is occipital area. Encephalocele, defect in skull, herniation of brain, swelling, most common site is occipital area. Retroflexion posture. Eniencephaly. Eniencephaly, fusion of cervical vertebra. Defect of occipital bone is present. Antenatal ultrasound finding is stargazer posture. Cranioarchycesis. Craniocaudal neural tube defect. Cranium, rachis is spinal region and schisis is splitting. Cranium, rachis spinal region and schisis is splitting. Cranioarchycesis. Craniocaudal neural tube defect. Antenatal diagnosis, ultrasound in 14 to 16 weeks of gestation. Earliest neural tube defect identified is anencephaly. Marker acetylcholine esterase, best unspecific marker. Increase in maternal serum and amniotic fluid, acetylcholine esterase. AFP, alpha fetoprotein, elevated at 15 to 18 weeks in maternal serum and it's a screening method. Alpha fetoprotein detected in maternal serum is a screening method. Prevention, folic acid supplementation, decrease risk of neural tube defect by 70%. Periconceptual supplementation more than equal to 1 month before planned conception. Periconceptual supplementation more than equal to 1 month before planned conception. So at least like more than equal to 1 month before conception. And folic acid supplementation reduces risk by drastically by 70%. Dose 400 microgram per day. Previously affected child, then give 4000 microgram per day. You can give 400 microgram per day, but there is one child already with neural tube defect, then 4000 microgram per day, that is 10 times. Neuronal migration defects. Defects of migration of neurons in the CNS, that is neuronal migration defects. Defects of migration of neurons in the CNS. First is lesioncephaly. Smooth appearance of brain, agyria, absent of gyri, decreased brain volume and expanded ventricle. Schizencephaly, clefts inside brain, schizes, splitting. Schizencephaly means splitting inside the brain. Porencephaly, pore, cystic spaces in brain. Cysts are lined by white matter. Pore, cystic spaces in brain. Cysts are lined by white matter. Can be secondary to cerebral infarctions, intrauterine period, perinatal birth asphyxia. Agenesis of corpus callosum, clinical feature microcephaly, low IQ, refractory seizures. Aicardi syndrome associated with agenesis of corpus callosum. Aicardi syndrome associated with agenesis of corpus callosum. It is a X-linked inheritance, severe in females and lethal in males. X-linked inheritance. It's an X-linked inheritance, so it is very severe in females but lethal in males. Here you can see an intact corpus callosum, and here agenesis of corpus callosum. Association, there is eye manifestations, infantile spasms, refractory seizures, vertebral defects like hemivertebrae, characteristic pits and lacuna and coloboma in the eye. Pits and lacuna and coloboma in the eye. Holoprosencephaly, failure of division of prosencephalon, single lobe brain, embryonic forebrain, cerebral lobes. Gene defect, sonic hedgehog gene. Because there is a defect in sonic hedgehog gene, prosencephalon doesn't divide and there is only a single lobe of the brain, that is called holoprosencephaly. Genetic associated genetic disorder, trisomy 13, Petau's syndrome. What is the genetic disorder associated with holoprosencephaly? Trisomy 13, Petau's syndrome. Trisomy 13, Petau's syndrome. Clinical features, midline facial abnormalities like proboscis, long and fused nose, cyclops, and cleft lip or palate. Associated facial abnormalities, and single lobe of the brain. Facial abnormalities is proboscis, long fused nose, cyclops, and cleft lip or palate, like medium face line abnormalities. Hydrocephalus, increased CSF volume inside the brain, more than 50 ml. Normal value of CSF is 150 ml in adults and 50 ml in infants. Normal volume of CSF is 150 ml in adults and 50 ml in infants. Causes, obstructive and non-obstructive. Obstructive causes, congenital anomalies, aqueductal stenosis most common, Dandy-Walker malformation, Arnold-Chiari malformation, vein of Galen malformation, tumors, posterior fossa tumors, torch infection most common, toxoplasmosis. So where do you see hydrocephalus? Obstructive causes and non-obstructive causes. Obstructive causes are way more common than non-obstructive causes. So you have your aqueductal stenosis, Dandy-Walker malformation, Arnold-Chiari malformation, vein of Galen malformation, tumors, posterior fossa tumors, torch infections most common, toxoplasmosis. Non-obstructive, increased production. Non-obstructive causes is increased production like choroid plexus papilloma, decreased absorption. Decreased absorption from subarachnoid space due to blood and pus. If there is decreased blood absorption, then subarachnoid hemorrhage, and decreased pus, Then meningitis. So that is a non-obstructive cause, increased production. Aqueductal stenosis. Most common cause of congenital hydrocephalus is aqueductal stenosis. Most common cause of fetal ventriculomegaly in ultrasound. Most common cause of fetal ventriculomegaly in ultrasound is aqueductal stenosis. Most common cause of congenital hydrocephalus is also aqueductal stenosis. Pathogenesis. Lateral ventricle, third ventricle opens into third ventricle, and then there is a stenosis when it is trying to open in the fourth ventricle. So ventriculomegaly on ultrasound, you will see lateral ventricle and third ventricle are enlarged, most commonly seen aqueductal stenosis. Dandy-Walker malformation. Cystic expansion of fourth ventricle, dilatation of posterior fossa, hydrocephalus, occipital widening, cerebellar hypoplasia. So what else is there? Cystic expansion of fourth ventricle, dilatation of posterior fossa. You see hydrocephalus, occipital widening, cerebellar hypoplasia. This is Dandy-Walker malformation. Arnold-Chiari malformation. Herniation of cerebellar tonsil into cervical canal of spinal cord through the foramen magna. So in Arnold-Chiari malformation, you can see the herniation of cerebellar tonsils into cervical canal of spinal cord through foramen magna. Types, type 1 and type 2. Type 1, age group adults. Type 2, young children. Association, type 1 not associated with hydrocephalus. Type 2 associated with hydrocephalus and meningomyelocele. Herniation of cerebral tonsil is seen in type 1 where it's happening in adults. Cerebellar tonsils, brainstem structures, fourth ventricle, everything can be herniated in type 2, which is happening in young children. Presentation, you have neck pain and headache in adults. Vein of Galen malformation. Increased venous pressure from high pressure artery, dilatation of vein, compress, obstruct CSF pathway, usually at the level of aqueduct, hydrocephalus. Increased pressure of venous return can cause heart failure, cranial bruit, prominent carotid pulsations. That could be cranial bruit or prominent carotid pulsations. Blood vessels in the brain, dilated VOG, vein of Galen is dilated. You can see cranial bruit and prominent carotid pulsations and hydrocephalus. Clinical features. Microcephaly, head circumference more than equal to plus 2 standard deviation. Increased intracranial tension. Dilated scalp veins, ICT, dilated scalp veins, decreased straining, bulging anterior fontanelles, wide separation of skull sutures, more than 0.5 centimeters, sunset sign, visible upper sclera due to fixation in downward gaze, increased intracranial tension, dilated suprapineal recess, compression of tectum in the midbrain can cause sunset sign. Upper visible sclera. Investigation, screening, neurosonogram, ultrasound at anterior fontanelle. Gold standard and definitive is MRI brain. Treatment, medical management, decrease CSF production by acetazolamide, diuretics, and carbonic anhydrase inhibitor acetazolamide. Surgical management, VP shunt, ventriculoperitoneal, ventricular catheter, catheter line tunneled under skin, Tube empties into the chest or abdominal cavity. This is VP shunt, ventriculoperitoneal shunt. So from the ventricular catheter lies under the skin and empties into the abdominal cavity. Complication: shunt associated meningitis. Organism: Staphylococcus epidermidis. Diagnosis: CSF from shunt tapping, CSF analysis. In the next video we'll see seizures disorders.